Hi everyone. So this will be a one-shot lecture on the topic of dental amalgam. I'll try to cover all these topics which are important from the university point of view. So starting with the introduction, first let's just know what amalgam is. So if I have a cavity on my tooth, okay, then I get if I have caries on my tooth and I get that caries removed and the dentist will form this cavity, okay. So amalgam is the filling material, the silver material we use for filling in the cavity. So, what is special about amalgam? That it is a special type of alloy in which mercury is one of the components. Okay, so how do we form this material? Is we take mercury and then we take a bunch of metals, so an alloy, and we mix them together and we set it in the cavity. Okay, then it is harder than any other filling material. So it is still one of the best filling materials from a strength point of view. Applications. So it can be used as a permanent filling material for class 1, 2, and 5 cavities. Okay. It can be used for crown restoration. It can be used for dye preparation. And it can be used as a root canal filling material. Okay. So these are the applications. Now coming to the composition of dental amalgam. So dental amalgam, mm, we have two components. We have this dental alloy, dental amalgam alloy, and we have the mercury. So this alloy, it is made up of a group of metals. So the metals are, it has 60% silver, 35% tin, 4 to 6% copper, and 1% of zinc. So what does silver do? It forms the basic component. So this is silver is the basic component of the dental amalgam alloy. Okay. It forms the basic component, it forms the matrix, and it provides the mechanical properties. Okay. Then we add tin in there. We add tin to enhance amalgamation. So it will allow everything to mix in together, provide plasticity. So it means that it will allow the amalgam to stay in the shape we put it in, and then it will increase the working time. So it will increase the working time, pretty self-explanatory. Then we add copper in it. So copper is added to increase the strength and the hardness of the alloy of the amalgam. And then we add zinc in it. So it is an oxygen scavenger. What this means is it will take away the free oxygen particles and to prevent the alloy from going bad, and it will increase the shelf life of the alloy. Okay, so just for a depiction, a pictorial depiction, we have the silver. This is the main metal we have. Then we have a few particles of tin. For strength, we added some copper, and then to increase the shelf life, we added some zinc. Okay, now this is our alloy. This is our powder. This alloy powder. Okay, now talking about this mercury. So this powder will form 50% of your entire amalgam, right? And then mercury will be 50% by volume in the amalgam. So, what is the purpose of mercury? It binds the amalgam together, so it will bind in this powder together and form a dough, right? It will form the set material, so similar. It provides necessary mechanical properties, so obviously the mercury will increase the strength and form the set material. It will provide the necessary working time and it increases the longevity and resilience. So it increases the shelf life, not shelf life, it increases the amount of time the amalgam can stay set in your cavity and it increases the resilience. So it prevents breaking of the amalgam, right? Now, talking about this powder, if I zoom in, right, and if I talk about the microstructure of this powder, dental amalgam alloy, then it will have particles of two shapes. Okay, this will have either this needle shaped particles or this spherical particles. Okay, so this is called lathe cut and this is called spherical. And how do we form the two shapes? So I have this bunch of metal, right? I took this metal in specific quantities and I'll take it in there and I'll melt everything together. Okay. So to form the two shapes, I will melt all these metals and then it can undergo this process to form the late cut metals particle, and or it can undergo this process to form the spherical particles. Okay, so here I have late cut and here I have spherical. Now what will happen first? I have melted all these metals together. For late cut particles, it will form a brick. I'll form a brick of all these particles mixed together, all these metals mixed together. Then it will undergo milling. So milling is basically a machine that will cut everything, and that milling will form these chip-sized particles. Okay. For the spherical particles, I'll have a chamber. Okay, I'll have this chamber where I'll put this all the melted metals together, and I'll let this machine fire this melted metal in this open space. Okay, so when it fires this melted metal, it will have there will be spherical drops that will be fired out, and they will cool down before hitting the wall. So it will form these spherical particles before cooling down. Okay, so these are the two shapes of dental amalgam alloy and how we form them, right? Now moving ahead with the classification of the types of alloy. Right, so dental amalgam, it is classified on four bases. First is on the basis of copper content. So if the copper content is less than 6%, then we have something called low copper alloy. And if the copper content is greater than 6%, then we have high copper alloy. Okay. Second is on the basis of zinc content. So if the zinc content is less than 1%, then we have low zinc alloy. And if the zinc content is greater than 1%, then we have high zinc alloy. Third is on the basis of shape of the alloyed particles. So as I told you, we have late cut and we have spherical particles. So the alloy is divided on the basis of the shape. So we have spherical, late cut, and if we mix them together, we can form something called the admixed alloy. So it will have both types of the particles. Okay. And now the fourth basis is on the number of alloyed metals. How many metals do we mix in together? Okay, so we had this mixture of metals, right? How many metals do I add it in here? This classification is based on that. So binary, it will have only two metals, the silver and tin, basic. Ternary will have silver, tin, and copper. And quaternary, it has silver, tin, copper, and indium. Okay. Now the fifth classification, it is the generational classification. Right, so it is how the amalgam evolved and what changes we made throughout the years to use the current material we're using right now. So the first generation we had only silver and tin. It was the basic doing the job. Okay. Then we added copper and zinc in the second generation to increase the strength and the shelf life. Right. Then in the third generation we formed something called um, silver copper eutectic alloy. So what is eutectic alloy? I'll discuss that later, but it had superior qualities to both the metals. So it had superior qualities than a silver and copper. Okay. Then in the fourth generation, we made high copper alloy. So we increased the copper content. Okay. And then we found high copper alloy. And the fifth generation, the most superior alloy we are using right now, we have spherical particles. So until now we were using the late cut particles, and now we are using the spherical particles, high copper alloy. Okay, so it is still high copper, but it has spherical particles. Now talking about the low copper alloy, now talking about um, the classification. So the main ones we have to study is based on the copper content, right? So based on the copper content, we have low copper alloy and high copper alloy, right? The high copper alloy, it is divided into admixed and single composition. So what this means is that the admixed will have both late cut particles and spherical particles, and single composition will have only spherical particles. Okay. So starting with the properties of low copper alloy, it has copper less than 6%, and then the high copper alloy has copper between 6 to 30%, and single composition has copper greater than 30%, right? Now, properties over here. So the strength is lowest in the low copper alloy. The high copper alloys, they have good strength. Corrosion resistance over here, it's very moderate. They have better corrosion resistance. The single composition one, it has the best corrosion resistance. Now talking about the expansion. So after I have filled, let's just say this is the cavity on my tooth, okay, and after I have filled this in with amalgam, and this one, the low copper alloy, it will expand somewhat. So the expansion is good in this case because it will seal in the margins so that nothing can flow in. So there will be no micro leakage of the oral fluids into the cavity. Okay, so this is good in this case. And then the second, the high copper admixed alloy, it does not have any expansion. And over here, the single composition, it has very minimal expansion. So even that is an advantage, sort of, so that if I fill in the entire cavity completely and if I seal it in, I know it's not going to expand and it's going to stay there. So it has good marginal integrity. Okay, so it's not going to go outside of the margins. Now, setting time. So it has a longer setting time, which is good. We get more time to work with it. It has fast setting time, and this has the fastest setting time, so it is a disadvantage. Now talking about the dimensional changes. So it has very high dimensional changes, which is not good. Disadvantage, right? Uh, this has low dimensional changes, which is nice. And then the single composition one, it has the least dimensional changes, so which is great. Then some other properties. This one is economic, right? It is the cheapest. It is less technique sensitive, so we don't have to worry a lot of about how we are working with it. Okay, and then it is easy to handle. Then this one, the admixed one, it is technique sensitive. So it means it requires like very careful precision of mixing everything together and working with it. And so is the single composition alloy. They are both very expensive and they have low Hg content. So why low Hg content? Why low mercury content is an advantage? Because mercury, having high mercury in your amalgam, it decreases the strength. So the high copper alloys, they can function with a low mercury content, right? So which is good, then they will have higher strength and better mechanical properties. Now moving ahead with the setting reaction of the low copper alloy admixed and the single composition alloy. So this is a very conceptual part. Pay attention. What do we have first? We have two in the amalgam. Remember, we had a powder, and then we had the mercury, right? So the powder, it has in the low copper alloy, we have one type of particle. We have silver and tin particles. Okay, so I took the powder and I made chips of these kind of particles. This is my alloy. Now, this silver tin particle, this is called the gamma phase. Okay, this is the gamma phase. This is just the name, how we name it. Now, if I take some mercury, so I added some mercury in it, right? And I mixed it together and I formed the amalgam. So what reaction took place was, is that you can see these orange particles, right? These orange particles, upon the mercury reacting with this gamma particles, we found gamma 1 particles and gamma 2 particles. So gamma 1 particles are these orange colored particles. They work as fillers. Okay. So what is filler? Filler is something that will occupy this entire space and add strength to the amalgam, right? And then a second particle was produced, that was gamma 2 particles. Okay, gamma 2 particles, they are weak actually. So they will reduce the strength of your amalgam, and that's why we don't use low copper alloy, because it has gamma 2 particles. It makes your entire amalgam weak, right? So after this, we came to the admixed alloy. So admixed alloy, what it has is, it has two types of particle. Okay, so in that mixture of metals, right? This mixture of metals we had up till now in the low copper alloy, we had only silver, tin, and we had some amount of copper. Now in the admixed alloy, we have silver copper particles. So we have silver over here. I have one particle of silver copper, and then I have silver tin alloy as well. Right. So I have increased the copper content, and now I have silver copper particles as well. So it is in the ratio of 1 to 2. right? So in my alloy, I have one particle of silver copper, I have one particle of silver tin as well. Now over here, now if I add mercury in it now, what will happen is that there will be formation of this gamma phase, like here, this orange particle, gamma 1 phase, right? And then along with that, this blue particle you see, this is gamma 2 phase. Again I have gamma 1 and gamma 2, same similar to this. But what will happen because of this silver copper particles is that the gamma 2, this blue part, it will be eliminated. Okay, so it will get converted into this eta phase. This green thing you see around the silver copper, it will the gamma 2 will get converted into this eta phase, and this eta phase is pretty strong. So over here now we don't have any gamma 2 particles. Okay, so this is an advantage that we have eliminated gamma 2, and in the final mixture we have gamma 1 and eta particles. Okay, then in the single composition alloy, what happens is we have only silver tin particles and we have high copper content, right, in here. So what happens is we have this gamma phase. Gamma phase is silver tin particles, okay, and we have copper in the mixture, and the mercury will come, it will react with this, and since it has spherical particles, okay, there are only spherical particles in this mixture, it will directly form the eta phase. Okay, so it will directly form the the eta phase, and then we have gamma 1 phase and gamma phase. So there is no formation. Over here we had formation of gamma 2, but in here we have no formation of gamma 2 phase, and hence it is the best amalgam, the best alloy. So because gamma 2 is weakening, right? So this was a simplified explanation. If you talk about the exact formulas of gamma, gamma 1, gamma 2, and eta phase, so gamma is your silver tin particles, right? This is your gamma. It has a formula Ag3Sn. Then gamma 1, this filler particles, it has a formula of Ag2Hg3. Okay, so it is when the silver in the particles will react with the mercury, it will form gamma 1, right? And then we have gamma 2, it has a formula of Sn7Hg. So when the tin over here, it will react with the mercury, it will form gamma 2. Okay, and then the eta phase. So eta phase has a formula of Cu6SN5. So over here, when we have Ag copper material, it will react with the gamma 2 phase. So gamma 2 was with uh, tin and Hg, okay, and then we reacted this with copper, so it formed copper and tin alloy, kind of. Okay, so this is the eta phase. Now moving ahead with the manipulation, how we actually manipulate and set it in the cavity. So first step is proportioning. What happens in proportioning is you have to take accurate consistency. Okay, that is very important for the properties. If you have taken too much mercury, if you have high mercury content, what will happen is it will degrade the quality of your amalgam. So the ratio between the dental alloy powder and mercury should be 1 to 1. So if I go back to this picture, the powder and the mercury, they should be 1 to 1 in ratio. Okay, 1 to 1 by volume. Then so that is the exact accurate proportion, right? It is called the minimal mercury technique. So this is like the lowest amount of mercury we can use. And if we have too much mercury, what will happen is that it will degrade the quality. It will make your set amalgam weak. After this, we squeeze the extra mercury out. So I'll tell you how that happens. And the final content will have less than 50% of mercury. Okay, so first what we do is we have this mortar and pestle, right? We add 1 drop of mercury, and then we add 1 drop, like 1 scoop of that powder. We mix it together using a pestle. So I have this pestle, okay. We will mix this powder and mercury together. This mixing is called trituration. Okay, after mixing them together, it will form a dough. So the powder and the mercury, they will form a dough, and I will take that dough, and I will place it in a cloth. Okay, and I will squeeze it. And after squeezing, I will have a few drops of mercury coming out. So that is the minimal mercury technique. It is squeezing it, all the extra mercury out. Okay. After squeezing that out, I will have I will have that set ball of amalgam, right? And then I will rub it between my fingers. So I'll take the ball of amalgam and I'll rub it between my fingers, like knead it to get a proper set mix, and then I will place it in the cavity. Okay, so you would know all these steps if you have done the manipulation of amalgam, and that is in the second year syllabus. And so, talking about the trituration, it is nothing. It is just placing the mercury and the alloy powder together in a mortar and a pestle, and we mix them together. Why do we mix them together? It is to remove the oxide layer from the alloy and allow the metal to mix with the mercury. Okay, and there are two methods. It is one is manual, which we do in our colleges, so that is using mortar and pestle, and the second one is mechanical. So that the mechanical one is automated, and in the manual method, we add this carborundum paste in the bottom of the mortar uh, to make the surface rough and make the mixing easier. Okay. Then the properties of well triturated mix. So after you have mixed it together, how do you know that it is properly triturated? Your mixture should be shiny. Okay, it should be cohesive. So it should not be going everywhere. It should form like one mass in a like stick together. Okay, it should remain coherent. So similar stuff. Okay, and if I drop the mass like from 2 to 3 inches, it should form together like a ball. Okay, it should stay together like one mass. Okay, it can produce light fingerprints on touch. So if I touch the ball of amalgam I have formed and the ball, okay, it will form some light fingerprints. Then talking about the mulling. So I have formed that amalgam ball and I have squeezed the extra mercury out. Now I will take the ball of amalgam and I will knead it between my fingers. Okay. So let's just say this is my thumb and this is my index finger. I will knead it between my fingers. And why is that? For further mixing of the amalgam to enhance its physical properties. So basically to knead it together. And then it can be also done through manual methods. So that is using our fingers and or using an amalgamator. Now, after this, the fourth step is condensation. So, condensation is taking this amalgam and placing this in our cavity. So, we use an amalgam carrier and we take small amounts of this amalgam and we put it in here. Okay, then we let it, and then we keep adding like small increments of amalgam until the cavity is completely filled. Okay, so this is called condensation. Then we have trimming and carving. So, to give proper shape, so if I have this tooth, right, and I have this cavity, so I have filled the cavity in with amalgam. Now I want to give it the proper shape of the tooth. So to give it the proper shape, I will do some trimming and carving. Then there's smoothing, so that is done using a ball burnisher. And then there is polishing. This takes place 24 hours after the condensation. Okay. Now properties of dental amalgam. Okay, so first property is micro leakage. So dental amalgam, it will not show any micro leakages because it expands. Okay, I talked about the low copper one, it expands. But what is micro leakage is when your oral fluids they leak into the cavity between the cavity margin and the restoration, so they will leak in here and it can cause corrosion, right? So if micro leakage happens, it can cause corrosion, uh, and but that will not happen in case of dental amalgam because over here it forms seal. Okay, so dental amalgam forms seal with the cavity walls and no oral fluids can leak in here. Okay. Then talking about the dimensional stability. So dimensional stability, it has some expansion. We know that dental amalgam shows some expansion. The expansion is about 20 micrometers per centimeter at 37 degrees Celsius. Uh, it expands this much about 24 hours after insertion. Okay, and the expansion takes place because of the growth of gamma 1 phase. So since the gamma 1 phase over here, if you see in the picture, the gamma 1 phase increases upon reaction, right? So this causes the expansion of the dental amalgam. Okay, then the moisture contamination. So the amalgam contains zinc, right? If the amalgam, the zinc containing alloy comes in contact with moisture or water, what will happen? Hydrogen will be released. So it will form zinc oxide and hydrogen will be released. This hydrogen will cause expansion up to 4% during condensation. This will only happen during condensation. So this hydrogen will cause expansion. And what can this cause is after filling in and the expansion and the restoration. Okay, so if I have this cavity and this expands by 4%, the restoration can come out of the cavity. So protrusion of restoration. If it expands on this sides, right, it will have expansion. It can cause fracture of the restoration. Okay, it can cause pain and pitted surface. So you can see since it expanded, we have pits on the surface. Okay, so this is moisture contamination. Then we have strength. Talking about the strength, it is not satisfactory. It is actually very good. It is affected by how we triturate it, the mercury content, how we condense it, and the porosity. Okay. Now the fifth property is creep. So creep is the time-dependent plastic deformation. So it is how the set material will change shape. Okay. It should be ideally less than 3%, the deformation of the set amalgam. And the eta phase, it decreases creep. So eta phase was good, as we discussed, because it decreases creep. The alpha 1 and alpha 2 phase, they increase creep. Okay. So although alpha 1 phase was good and it gave strength, but it also increased the plastic deformation. It is also dependent on the mercury to alloy ratio. It depends, a high condensation pressure also decreases creep, and depending on how much we triturate it, it also affects creep. Okay. Now talking about the advantages and disadvantages of the dental amalgam. So the advantages are that it is easy to insert in the cavity, so it is not very technique sensitive. Okay, it maintains the anatomical form of the tooth, so it will stay in the shape we put it in. There are low chances of fracture as it is a very strong material. It has low marginal leakage because it forms this seal with your cavity margins. Okay, so there won't be any leakage, and then it has prolonged life, so very long lasting. Okay, then the disadvantages that it has no color match with the tooth, that's why we can't use it in the anteriors. Okay, it is highly brittle, so although it is very strong, but it is easy to fracture it. Okay, there are good chances of corrosion, so it contains metals, so it can corrode. Okay, it is very high in galvanic action and it breaks down with time, although everything breaks down with time, but it is considered as a disadvantage. Okay, uh, no bonding structure with no bonding with tooth structure, so it has no mechanical, it has no chemical adhesion. Okay, so if this is my cavity margin and this is my restoration, so it has mechanical adhesion to the walls, right? But it will not form bonds with your enamel or dentine. Okay, so it has no chemical bonding with your tooth structure, so that is a disadvantage. Now, another topic, small topic that we have to discuss is toxic effects of mercury. So we use mercury in amalgam and it is banned in a lot of countries because we know that mercury is toxic. But still the amount we use is not really harmful for humans. It's a very small amount. But what are some effects we can consider? That clinic should be well ventilated. So if we are using mercury, your clinic should be well ventilated. How do we dispose of the excess mercury? So this is really important. Okay, excess mercury should be disposed in a proper tight container. through proper disposal system. So there is already a well-built disposal system. You cannot just throw off mercury in your normal bin. It should be sealed in a tight container, and then the disposal system will take care of that. Okay. If mercury is spilled, it should be cleaned. Amalgam scrape should not be subjected to heat sterilization. This is also really important. Any scrape, it should also be put in that um, container. Okay, and amalgam supplements, suppressant powders can be used. So there are powders which take away your mercury, excess mercury. So mercury suppressant powders, they can be used to minimize the risk of mercury poisoning. Okay, not poisoning, but harmful effects of mercury. So that's it for this chapter. I hope this lecture helps you, and if it does, please subscribe. Around 85% of you have not subscribed to this channel. So thank you for watching. And if you liked the lecture, please like and subscribe. Thank you.